Did you know that over 90% of the people who have insulin resistance don't even know that they have it, and that they actually have metabolic syndrome, which is the silent driver of diabetes, heart disease, and even some cancers? In this video, we're going to break down how to tell if you have metabolic disease, the signs and symptoms you need to be aware of, the chronic diseases linked to metabolic syndrome, and most importantly, how to turn things around. It's staggering to think that 1 out of every 3 adults has metabolic syndrome in the US. But the good news is you can reverse it naturally. It's still hard for me to take a good look at this picture, but that is me. I'd say about 18 years ago, and I had severe metabolic disease. I had 2 very high-risk pregnancies and didn't realize what was going on. But let's take a look at the 5 criteria for metabolic syndrome. And of the 5 criteria, you need 3 of these. And if you have 3 of them, then you have metabolic syndrome. So the first one is, do you have a high waist circumference? And that's referring to belly fat. So belly fat isn't just about looks. It's a sign of dangerous visceral fat around your organs. So if you're a man and you have a waist circumference of 40 centimeters or 40 inches or more than 102 centimeters, then you meet that criteria. If you're a woman and you have over 35-inch waist or 88 centimeters, then you meet this criteria. The next criteria is high blood sugar. If you're pre-diabetic or you have type 2 diabetes. So if your fasting glucose is over 100 milligrams per deciliter, or you're already diabetic taking medication, then you meet this criteria. Symptoms that you might have if you're in pre-diabetes or have diabetes would be fatigue, frequent thirst, urination, and sugar cravings. The third criteria is high blood pressure, or if you have hypertension. So if you have a blood pressure of a systolic of 130 over a diastolic of 85, if one of those numbers are high or both of them, then you have hypertension. And if you're already taking hypertension medicine, then you meet this criteria. And what's really important about hypertension is that it requires your heart to work overtime. So the analogy I used to like to give my students is, imagine if you had a hose with the nozzle off and you put your thumb in front of the hole and you're blocking some of that opening. You're creating resistance. Well, with hypertension, it's harder to get the blood through. You have vasoconstriction. And what's pushing that blood through? Well, it's your heart. Specifically, it's the left ventricle of your heart. And that left ventricle has to pump harder to try to get the same amount of blood to all your organs and cells and tissues. And what happens when we resist our muscles? They grow, they hypertrophy, they get bigger. And that's what happens to the left ventricle, particularly the wall of the left ventricle. If that is working harder, that muscle's gonna grow and it's gonna get thicker, and then the chamber gets smaller. So when the chamber gets smaller, on each pump, each contraction of that heart, it puts out less blood because now the chamber's smaller. So now your heart rate has to go up to meet that cardiac output. So now it's pumping harder and now it has to do more beats. So treating hypertension is very critical and probably one of the first signs of metabolic syndrome. The fourth, you have high triglycerides. That's the amount of fat in your blood. And if you have over 150 milligrams per deciliter, or you're on a triglyceride lowering drug like fibrates, then you meet this criteria. And it's excessive carbs, not excessive fats in your diet. It's excessive carbs that turn into triglycerides, and that's what clogs your arteries. And then the fifth criteria is low HDL. HDL stands for high density lipoprotein. That's your good cholesterol, right? And the good cholesterol helps to get rid of the bad cholesterol. So if you have too little good cholesterol, that means you're in trouble. Let's talk about how to spot if you have metabolic syndrome early. And we're going to talk about some signs and symptoms. And I like to clarify the difference. A sign, a clinical sign, we would say, is something that is objective that we could measure. So the signs that we can measure, we talked about a lot of them already, is a high fasting blood glucose level or blood sugar, high blood pressure, high triglycerides, low HDL, a large waist circumference, fatty liver, dark patches. Let me show this picture to you. It's called acanthosis nigricans, and it's darkness. You'll see it around the neck, under the arms. Women can get it under the breasts, and it gets like a thicker but a velvety skin. That's a telltale sign that you have insulin resistance, that you're pretty advanced already. Skin tags, we were all thought because it was you get them under your arm, friction, but skin tags are a sign of insulin resistance. And then excessive body fat, particularly around the abdominal section. You're an apple shape, right? You're not a pear. Pears have a small waist, bigger hips. Metabolic syndrome is typically that apple shape, and it's the fat that's underneath the abdominal muscles. So the symptoms are things that are subjective that you would feel or experience. So sugar cravings and energy crashes, oh my gosh, I have no energy. You're going to go for that candy bar in the late afternoon. That's something we can't measure, really. Brain fog and difficulty concentrating. That is, we certainly know it's happening. I've experienced that, but there's no objective way to measure that. But we would listen. If you're having that, that's an important symptom, because this is supporting the fact that you're having some metabolic dysfunction. And joint pain and stiffness, that's the early signs of osteoarthritis. Let me tell you something. When you get rid of seed oils and lower your carbs, all the arthritic pain that you have is either gone or greatly reduced, depending, of course, how bad of the level of arthritis you have. And as a physical therapist, I treated people with chronic pain for many years, and family members and people I know, reduce your carbs and you'll see how that pain goes away. So somebody I worked with, Randy, was a great cyclist, and nobody could eat a whole sleeve of Oreos like him because he was cycling so much, tons of miles, but his knees were killing him. And as soon as he got rid of the carbs, he had trouble going down the steps, with pain, because of pain and stiffness. As soon as he got rid of them, the sugar and the carbs, pain went away. And then frequent thirst and urination. You certainly know that's happening. It's not an objective measure, but you know it. And here's the thing. By the time you have some of these symptoms, your body likely has had metabolic dysfunction for years. And that's why early screening is so important, paying attention to these signs and symptoms, and some other blood work that we'll talk about. So how does this work? Let's just talk about insulin for a second. It is so important. It does so many things. It tells so many parts of the body how to work, when to work, and what to do. When cells stop responding to insulin, that's what's called insulin resistance. The cells get full, they don't want any more, and your glucose is staying in the blood too long, and the insulin's being produced, but the cell's saying, I don't want any more, stop, right? And when the sugar stays in the bloodstream, that's when your glucose level starts coming up. So what the pancreas will try to do, and tell me if you can relate to this, because this is how I lived many, many years. The pancreas then will put out more insulin, and then finally it forces the cell to take in that sugar. And what happens then when that second round of insulin comes out, then it's like your blood sugar bottoms out all of a sudden, right? And you might get sweaty and feel shaky, and you get hungry, and that's when you feel like, I got to eat something again. Put it in the comments if you're experiencing that right now. That's why you can have a plate of pasta and in an hour feel like you have to go eat again, because your cells during insulin resistance, they're not able to take the glucose in and use it for energy. That's the problem, and that's why you get the cravings, that's why you get the crashes. And so when blood sugar stays high, insulin stays high. And when insulin is high, it tells your body to store fat. And when insulin is high, it leads and is the root cause to all the metabolic chronic diseases. Let's take a look at prediabetes and insulin resistance. So this is a very important, it's a little complicated, this slide. On the bottom, going across the bottom, you have years. So what I want to really demonstrate to you on this slide is that you have been developing an insulin resistance for years. Your insulin levels, and you have hyperinsulinemia for years before you ever, and you're in prediabetes before you ever become diabetic. And this is one of the problems, and I want you to ask your physician to do a fasting insulin level on you, because that will tell you years ahead of time before you ever become insulin type 2 diabetic, okay? But otherwise, physicians don't usually order it. But what happens, you'll see in red, that's the pancreas beta cell. That's the pancreas producing insulin. The blue line represents you're getting insulin resistant. So you're getting insulin resistant, the beta cells produce more insulin, and the insulin's getting worse and worse until finally the beta cell poops out and can't produce anymore. Up on top, it's showing you blood sugar. The yellow is fasting blood sugar, and the orangish is post-meal glucose. And you can see, like, as insulin resistance increases, your post-meal glucose stays elevated longer. And when it stays elevated longer, that means insulin stays elevated longer. And it's showing you that yellow line, you're staying below 100. If that yellow line, you're not pre-diabetic yet, but you can see when it crosses that line about at 100, then you're spending time there before that line of when you become diabetic and you hit 125, and that's pre-diabetes. You're pre-diabetic all the way up till there, and then it's showing you on the right, if you go up, that you're in diabetes, right? And if you look down at the red line, then that's when beta cell function happens. So your glucose is not going to go up until that beta cell function occurs. So in the meantime, you have had elevated insulin for so long and your cells were not responding, and that's when you're starting to become hypertensive. That's when you're starting to get skin tags. That's where your stomach starts getting bigger. So now let's take a look at the insulin resistance and the chronic diseases. So with metabolic syndrome, you first get insulin resistance, and then that leads to chronic diseases. But know that the root cause of this is insulin resistance, and let's back up one more time, and it's overconsumption of carbohydrates and seed oils. And so metabolic syndrome is the real danger. So if it's left unchecked, it can develop heart disease and stroke because of the atherosclerosis and the clogged arteries. You'll get non-alcoholic, I forgot to mention that one, fatty liver disease, that's excess carbs, and insulin resistance leads to liver damage. And if you're in stage 1, non-alcoholic fatty liver disease, it can be reversed. But once you get to stage 2, you may not be able to reverse fatty liver. So that's really important to find out that. And they can check your liver enzymes to see, and do an ultrasound to see if you have fatty liver. Alzheimer and dementia, type 3 diabetes, excessive carbs leads to insulin resistance of the brain. And the great thing about ketosis is, and the ketogenic diet, is that the brain loves to use ketones. So, and it also has a neuroprotective quality to it. PCOS is common with women with metabolic syndrome. They can't get pregnant. They use metformin to treat PCOS, but imagine if you just gave up carbs and did it naturally and put some good fats in there and good proteins. These women get pregnant, can turn around and get pregnant. So if you know someone, please let them watch this video. I'll do a specific one for that in the future. Certain cancers like colon, breast, pancreatic cancer, the chronic inflammation and high insulin promotes cancer growth. And not all cancers, but the ones I mentioned. Osteoarthritis and joint pain. Excess weight, first of all, can lead to early and premature wear and tear of your joints. As a physical therapist, I see it all the time. That causes inflammation, and the high blood sugar damages joints. Everything gets oxidized. And so people with a lot of osteoarthritis, I can bet that they probably have insulin resistance. Now there's some that you get from injury, but a lot of it is associated with that. Kidney disease. When you have high blood pressure and diabetes, that damages kidney function. And then finally, gout. We thought gout was because of fatty foods. Gout is because of high insulin levels, interfere with uric acid elimination. And also, if you eat a lot of processed foods and you're getting high fructose corn syrup, that really exacerbates it as well and can cause gout. So, how to test yourself for metabolic syndrome? Well, you want to know where you stand. Here's how to check. So you want to measure your waist. Are you over the limit? Okay, remember you needed 3 of those 5 categories. You want to check your latest blood work. If fasting glucose, if that's elevated over 100, triglycerides if it's over 150, and HDL if you're a man under 40, if you're a woman under 50, and your blood pressure. So the blood pressure you can definitely do at home. If you are already diabetic, obviously you have metabolic dysfunction, but it can be put into remission and reverse. I just did a video which low carb diet's right for you, and we talked about Virta Health in there. They did a 5-year study, and 90% of folks put their diabetes into remission. And those that didn't, reduce their need for insulin. So you want to check your blood work. Use a glucose monitor, a continuous one if you have one. If not, Keto Mojo has a glucose and ketone monitor in one. You can purchase that. And then please, this is the most important, ask your doctor to get a fasting insulin. So you can test fasting insulin and do a HOMA IR, and that tells your doctor, that tells you how severe your insulin resistance is. But doctors don't check it, but it's critical, so insist on it. Say you have however many, 3 or 4 or 5 of the signs of metabolic disease. You want an insulin resistance, an HbA1c, and a fasting glucose. So let's take a look at the HOMA IR. The HOMA IR stands for Homeostatic Model Assessment of Insulin Resistant. So it's an early warning system. It detects insulin resistance before blood sugar becomes abnormal. It's a stronger predictor of disease, more accurate than fasting glucose alone, and in predicting diabetes, heart disease, PCOS, non-alcoholic fatty liver disease, and even cancer. And so If you take a look at the formula there, HOMA-IR is calculated by your fasting insulin times your fasting glucose and divided by 405. And to interpret the value then, if you're less than 1, you're highly sensitive, and that's ideal. Meaning, if you are between 1 and 1.9, that's still considered normal insulin sensitivity. If you're 2.0 to 2.9, you have mild insulin resistance. And if you're greater than 3, you have significant insulin resistance, and you probably already have metabolic syndrome, prediabetes, and type 2 diabetes. Simple changes make huge differences, and most people see major improvements just in a few weeks. And what you want to know is that initially on a ketogenic diet, you'll lose a lot of water weight, but then you begin to lose fat. And I have plenty of videos, good fats, bad fats, total carbs versus net carbs, and then which low carb diet is right for you if you want to check out the playlist. However, if you are already on your way pre-diabetic or have diabetes and you want to reverse it, and you want to reverse insulin resistance and prediabetes, I suggest a ketogenic diet or a ketovore. But here are the 5 steps to reverse your metabolic disease naturally. Got to cut sugar and refined carbs. So they reduce. You have to reduce insulin spikes. So anything with flour, potatoes, anything starchy, anything juices. I recommend you have berries, strawberries, blueberries, blackberries, raspberries are better. They have a lot of fiber and they're lower carbs. You want to eat whole and unprocessed foods. Focus on protein and fats and good fats. And like I said, check out good fats, bad fats. Don't be afraid of saturated fat. So, 3, prioritize movement and strength. If you can, I say it's 80% diet and 20% movement. If you just take 10 minutes after each meal and go for a 10-minute walk, that does great things for your blood sugar. It's going to use the glucose that's in your bloodstream up and for those muscles, because when you walk, you're using the larger muscles in your body. That's going to take it right out of your bloodstream and make it easy and reduce insulin resistance. You want to strengthen your muscles as we age. One of the reasons why we get metabolic syndrome as we age. Now I'm going to be 60 in a month and a half, and I lift and I do resistance training because the more muscle you have, that's the big sink where all the glucose goes. It can go to the liver, 100, 200 grams can be stored there, and then 300 or so, maybe a little bit more grams in the muscle. And the more muscle you have, the more places you have to put the glucose. The body only wants like a teaspoon or 5 grams of sugar in your bloodstream. It will do whatever it has to. If too much sugar is in your bloodstream, it glycates or ages all your cells, if you can think about it that way. And so by having more muscle, you can put that glucose right where it needs to be. And if you're not eating a lot, you won't have an excess level of it. You want to improve sleep and manage stress. Easier said than done, but sleep is really important. So if you cannot eat like 3 hours before you go to bed, that'll allow your body to tap into, when you become fat adapted, if you're on a ketogenic diet, then your body is going to run on your fat all night long. And you will get better sleep if you don't eat right before bedtime. But when you are stressed and you don't have enough sleep, it produces more cortisol, and that elevates your blood sugar as well. Stress is a big one. And if you have a continuous glucose monitor, you'll find that your blood sugar goes up during stressful moments. And then you want to track your progress. So you want to get the labs done regularly and watch your health improve. But you also want to get the non-scale victories, like is your joint pain gone? What's your pain level? I want you to take measurements all over your body, your chest, your waist, your hips, your thighs, your neck. I mean, when you look at those pictures of me, my neck was huge. I feel like I have this scrawny little neck now. But I never wore necklaces. I still don't, because I used to have a big neck. I never wanted to draw attention to it. So track your progress, get your labs done, talk to your doctor, talk about tell them how many of those metabolic criteria you meet, and that's why you want the insulin test done. And again, you'll see that the thing I found with my clients and myself, the biggest weight comes first off the midsection and your abdominal, and the visceral fat comes off pretty quickly. So it works great, but I caution you, this is a lifestyle, because what got us here before is right around the corner. So check out, before you go, check out which low carb diet's for you. Check out good fats, bad fats, and then total and net carbs, how to count. And if you have any questions about a ketogenic diet, a topic that I haven't covered, put it in the comments below and I'll try to get a video out right away. But if this was helpful, I'm a new channel, please consider subscribing and hit that notification button, so whenever I post another video, you'll be the first to see it. All right, I'll see you in the next video. Thank you.